All right, everybody, welcome back to another episode of Honestly Bilal. I'm your host, Bilal Med, and I'm a fourth year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk with medical students who are interested in ophthalmology, residents who are training in ophthalmology, and current ophthalmologists in the field today. My guest today is Dr. Rishi Singh. Dr. Singh is a staff surgeon at the Cleveland Clinic Cole Eye Institute. He's also the medical director of informatics at the Cleveland Clinic and an associate professor at the Lerner College of Medicine in Cleveland, Ohio. Dr. Singh did his medical degree at the Boston University, followed by a residency at Mass Eye and Ear Harvard Combined Program, and then a fellowship in vitreoretinal surgery at the Cleveland Clinic Cole Eye Institute. Dr. Singh, welcome to the show. It's an honor to be with you. When I reached out to you on Instagram, I figured it was one of those things where I took a shot with it and you were kind enough to say, yeah, sure, I'll come on the show. So this means a lot.
Bilal, you have a really great following going, and I'm really impressed with what you're doing. So I'm so glad to be a part of this today, and I'm so glad to talk to people about myself and what we're kind of doing here at the Cleveland Clinic.
Very cool. Yeah, we'll go right to it then. So, what I like to ask most of my guests is kind of what I call an origin story. So, what is your origin story when it comes to ophthalmology and retina, and what got you into the field?
Yeah, it was a kind of an interesting situation. I was in one of those work study programs in college, and they allowed you to work in the food hall, or they allowed you to work in the dorms. And I decided that I was going to work in a research lab washing dishes, actually. And turned out it happened to be a corneal research lab. And the principal investigator there said to me, you can wash dishes, or you can do Western blot or Northern blot, or learn how to do these sort of techniques. It was a basic science research lab. And I learned so much from that person, because that person was inspirational about teaching me about ophthalmology, guiding my career in the direction it's gone in. She critiqued my papers. I remember getting my papers back with all these red marks on them. But it was the person who thought I could do more with myself and believed in me, and really has supported my career. Her name is Vickery Trinkus Randall. She's still at Boston University in a basic science research lab. And I owe a lot to her for what she did. And then when I went to Mass Eye and Ear, it was one of those situations where, as a first year ophthalmologist, or should I say resident, you're focused on the hardest thing possible, which is visualizing the retina. Mm-hmm. And I figured, if I could visualize the retina and do retina surgery, everything else would be pretty much easier. And so let me just take the hardest thing and try it. And I fell in love. I realized how much there was to do, how many therapeutics hadn't been thought about or even pioneered, how it was an incredible area for research and growth. And so I was super happy becoming a retina specialist here through Cleveland Clinic and the fellowship I did here at Cole Eye Institute.
Very cool. Yeah, so I think it's one of those things too, and you touched on it, and it's definitely something a lot of us are going through right now, where we think about the people who believe in us and our mentors, and it's just crazy how much one person just having a little bit of confidence in you can really inspire a whole world confidence in yourself. And I think that's why mentorship matters, and that's why I think the great thing about this show is connecting with a lot of people who are willing to share their stories, so we can hear from that and learn about that journey as well.
And one of the things I've begun to realize is how fluid mentorship is. So it's not just that you have this one person at one given time, it's that you have many people at given times for various reasons. And then eventually, you might be a mentor to somebody, and how you properly coach and encourage them. I've taken some coaching and mentoring courses here in Cleveland, because I end up being a coach and mentor to a few people, and I end up being mentored by others. So it's great to understand both sides of that coin, especially when the conversations can become difficult and hard.
Sure. Yeah, that reverse mentorship of being able to give back to your own mentors too, if you have the opportunity, is always a very unique thing.
Absolutely, yeah.
So, I know that you're involved as a medical director of informatics at, Cleveland Clinic. And a lot of your work is done with big data. And I'm kind of person who's trying to learn more about big data, what that really means. So talk to us about what defines big data, and how that, is something that's really transforming in this time and day and age.
Yeah. I'll give you the origination of this for me, and how it kind of became my research focus for this past couple of years. When we first went on to electronic record, we were the last department in the Cleveland Clinic that was not on Epic. Mm-hmm. And so we had first gotten the ophthalmology kind of piece from Epic, which was really just out of the box poor. It needed a lot of work. And I spent a good 6 months to 9 months fixing it, making orders, making, forms that you see in the chart where you can enter your laser numbers, all that stuff. Nothing was there. And
Sure.
we were the fourth institution in the country to get this product, and none of them were really high volume or anything else. And so I retooled the whole thing. I worked with my group of people here. Thankfully, my chair was very supportive, Dan Martin, about getting me the resources I needed to make those changes. And what's come about that is we went through the process of building the system so that we could store all this data. Because ultimately I was a clinical researcher at heart, and I realized the data was really important to capture because, you want to do a retrospective study, or you want to look at disease pathogenesis or treatment outcomes or quality metrics or safety events or anything, and business metrics. You want to have good data as your underlying resource there. So we've done that, and we've collected that for years now, since 2012. And not only is it the data, the clinical data that goes along with it, it's the imaging data that goes along with it. So you can imagine how valuable that is, because right now when you look at the big data environment, there's very few places out there. Like, let's look at IRIS, for example, the AAO's registry. It's a great registry. It has tons and tons of patients, but it has zero imaging data associated with it. So to have the imaging to go alongside it, plus having things categorized properly, makes it a very, very valuable endeavor. And so from that, we have established a Center for Ophthalmic Bioinformatics, where we analyze and use the big data, our data set, which has grown now from 2012 to have almost 5 million unique lives in it. And we basically can capture and look at information in various disease states where they're quite rare. So recently there was a lot of stuff on the Emleron, things that was bladder related drug that causes maybe an AMD-like phenotype. We heard about this at this meeting, came back, we were able to pull a list within a week. We had pictures, we had clinical information on these patients. We could email them and tell them to come in for exams. You can really see the value of such a system in place, and we have that now, and it's really great to have that now to ask questions. And our lab has 4 principal investigators, roughly about 17 or 18 med students right now, and it fluxes between 15 and 20, and just a huge amount of work that's being done. And we have commercial partnerships as well as research funding from the Research Blindness Foundation and Fight for Sight in our group that are helping us kind of meet those goals. So big data is sort of that larger term. And then you have like things like, obviously machine learning and deep learning. Right. And those are taking the data and teaching the system to make intelligent decisions with that data. And that's the type of stuff we're doing now. We're working on a lot of different things, and we're looking at a proliferative diabetic retinopathy calculator to see, what are your risk factors for progressing to PDR versus a patient who doesn't progress. We're doing that now in combination with a pharmaceutical company. We have another algorithm that's looking at OCT reading, automated OCT reading, which is coming out next year. So that's a really neat thing. And I'm part of the AAO's AI committee as well, because there's a lot of discussion we have to have about the moral and also logistical issues with these sort of techniques and technologies. So it's really been my niche in my career continues to evolve. I can't tell you in 5 years or 10 years if this is going to be the niche, but it seems like a good niche so far. I've been very happy with it. It's been very productive. We've written a lot of papers from the work we've done here, and it's just been a super interesting way to ask and answer questions.
Yeah, no, I read today somewhere that it's there's an epidemic now of AI learning in ophthalmology, and the papers being produced. So it sounds like you're at the forefront of that, and it seems like it's a very exciting road ahead. With the challenges of sure, but hopefully things that will make patient care better and teach us all along the way, especially for our generation too going forward.
We are just such a unique specialty. I mean, you think about it for a second. The first artificial intelligence algorithm ever FDA approved was an ophthalmology algorithm. Mm-hmm. That's amazing, because radiologists have tons of images and cardiologists have tons of images, but the ophthalmologists are the ones who led the way. And that's super proud for all of us.
Sure. And one of the things that we talked about before we got on here, and again, it's one of the ways I found you was another niche you have, and that's social media. And that's something you've really invested in with a website, very successful. That's, also an Instagram page. That's where I found you, like I mentioned. So, talk about why social media is important
Yeah.
this day and age, and how much importance it's going to have going forward in ophthalmology.
Yeah. Well, I think people look at social media and they laugh sometimes. They're like, are you a Kardashian, or why are you doing that? It's like you're trying to look cute or do whatever. That's not the point of this. The point is we are a teaching institution like a lot of institutions out there, and our residents and fellows learn. And sometimes you don't have all of the time in the world to point them to something that is of interest, right? So an article, a video in surgery, a case, for example. And so I found myself a lot of times saying, oh, this new study came out last week, and the fellow would look at you like, what? I don't know that study. Or the resident would look at you and say, I don't know anything about that surgical technique or
Mm,
whatever. And so what this was a couple of different things together. It was first to create a sort of a library of resources for people that we were teaching. So ways of highlighting some of the work they're doing. Secondarily, it was to highlight the work we're doing at the Cleveland Clinic. I mean, we are a really high volume, high clinical care institution. And also we have great researchers here. And so some of the research I'm doing and with my fellow colleagues here is part of the stuff that I talk about in those social media posts. And then giving to our community. I mean, we all play a part in our community, and I highlight some of the things we are doing in our community to give back. And then, I think it sort of serves all those purposes. And just think about this statistic for a second. And this is, I think, why I also was super interested. 75% of people look you up on the internet before coming to see you.
mm,
Happens to me all the time. People come to me and say to me, I saw you on the website, or I saw you on Facebook or Instagram before I came to see you, because they want to learn about you. They want to hear about who you are as a person. The other thing that was interesting was that of the people that were polled, 80% of them said if you have a social media presence, they consider you of a high reputational caliber. So that's shifted a lot. Maybe 10 years ago was the number of papers you wrote, or your stature as a professor of ophthalmology or something like that. It's different now.
mm.
And so we have to evolve our thinking a little bit about this. And so what this social media thing has been is truly an experiment for me. Initially I had a consultant that sort of helped me with different things. And since then I've taken it back to myself, and I've done it all on my own because I want to put my own voice to it. But the consultant was helpful because they pointed out like just the basics, like how you do certain things, how you can hashtag, when's the right time to post things, what should you be doing, and in which medium, like whether it's Facebook or Instagram or LinkedIn or whatever it is. And so that person was very, very helpful to me to get me started. And now I'm doing it all on my own. And I've been very happy doing it on my own. I think it has valuable resources. Just yesterday, one of my colleagues was telling me that we're doing, virtual interviews this year for all of our specialties. So how does somebody learn about you before coming to see you? I mean, it's kind of awkward, right? They're sitting on a video camera, or potentially not meeting them ahead of time. And, we have them in a room, or we had dinner with them or did something with them. So now it's kind of different. For everyone who sees my social media account, they can go and learn about me before they even come to interview with me. And so they might get to know me better, or think that they are, this is a person of like mind or like caliber or like interests of mine. So I align myself with them. I want to come to your institution.
Sure.
So that's been another area where I think it's been very helpful. And I think this continues to grow. I love doing it. I think it's very helpful to people. And I'm just going to continue doing it, and hopefully it'll continue to grow.
Yeah, and the thing is that it can only grow. I think that's one thing I've really realized, that it can't really shrink. It can only grow bigger. So the one thing
Yeah.
that's interesting too is, it's almost a concept where there's a brand element to it, to where you honor the part of what parts of you are the ones that you really feel like, from a professional standpoint, that you can put out there that you're good at, or hopefully you want to develop, and people can take away from that what they want. And the community building from it is such a powerful aspect, and it really gives everybody a voice. I think that's a really important thing behind it too. So
Yeah, two things I will say about it. I think the first is that obviously it's very helpful when you're trying to explain to patients maybe that the study they just read about wasn't perfect,
mm,
right? We had this problem recently with the eplerenone studies that were done for essential serous. I have a ton of patients I've treated with this drug. They've done fantastically. And a really, I would say crappy study in Europe was done. And the study really wasn't the way we practice with this drug right now. And so if you read the study and you saw their, cute vignettes, you'd say, why am I on this drug?
Mm.
And I had to get out there and tell people the study wasn't all what it was baked to be, and we really should consider a better study to evaluate it. So my patients can read it. My providers who I'm sending patients to or coming to me for can understand what they're talking about. And the other aspect is that I love educating people.
Mm.
And I find this as to be a very, very strong educational tool for a lot of people on whether it's, the newest upgrade of a software in clinic to a new device we have to a new drug we're using and what our outcomes have been. It's just been a fun way of educating people, especially in COVID-19, where everyone's home. And we used to do in-person meetings, now we're doing them all virtually. A way to just kind of give them some education when they're at home right now.
Yeah. And I think it really gets that aspect of communication between you and the patient, hopefully. At least that's something I'm interested in learning about. I'm sure that, like you touched on, it makes it even easier because everybody these days is, for better or for worse, finding out a lot of their information, on social media when it comes to, whether it's COVID-19 or other things. So, if we can use that for something good to educate the patients, like you're saying, that's really interesting. And I think you bring up a really good point there as well.
And I think the important thing to remember for anyone who's watching this right now is don't ever post anything that you don't want to see again.
Mm.
so it's one of those things where you just have to be very careful about what you post, because people are going to look at you, and maybe 5 years down the road that might not seem the most preferential way to do something. So just be careful about that. And I think it's important to always use your inner self, what you'd want to see yourself, or how you treat your mother, for example, is the way you should kind of put those recommendations out there.
Yeah, that makes a lot of sense. And one of the things that you've done beyond all the things that we've already talked about is the Retina World Congress. That's one of your initiatives. You're also the chair of the Hawaiian Chair Retina and Ocular Surgery News New York. So I mean, you've used a lot of these. You've been a part of a lot of these platforms of societies and the leadership potential and beyond with them, and really building the community of retina specialists and ophthalmologists. So in a time like this where we're unsure about a lot of things and we're really seeing the bridge of these societies being able to really utilize, these sort of forums, whether it be webinars and whatnot. What have you taken away for your own societies, and what can you teach us about each of those societies that you're a part of?
Yeah, I'm super proud to be involved in these organizations, and even the American Society of Retina Specialists, which I'm a board member of too. These are ways of educating our colleagues in our field, and they all serve different purposes. Retina World Congress came from the belief that there was a lot of retina being done across the world. Some of the techniques and technologies and drugs were being used there first before they came to the US. And so why not have a stage where you could have a lot of international speakers come to the US or come wherever we had the meeting and really provide their gist of information that you might miss if you were at just a general meeting in your community or in your state.
Mm.
So this is a way of sort of breaking down those barriers, have an equal footing of different people from different states different countries come in. In the first Retina World Congress, we had something like 75 countries represented, which I thought was amazing.
Got
And in the next iteration, which is coming shortly, is probably going to have, if not more. And it's just such a great opportunity for us to learn from our colleagues across the pond, across the world, and what they're doing. And I think, I'm fortunate I get to spend a lot of time overseas and before all of this, obviously, but overseas and learn from people and learn their techniques and learn what their approaches are, because some of those have been integrating in my practice from that.
Mm.
And I think that just allows everyone to kind of come to this meeting and learn from that. And Retina World Congress wasn't started by me necessarily. It was actually started by 4 founding partners, societies, that were the Brazilian Retina Society, the American Society of Retina Specialists, and 2 others, to really just sort of create this Congress atmosphere that people felt equal and could participate in without having the hitches of, I need a membership to join, or I need an annual dues to join. So kind of a different outlook altogether. And then, I've been a participant in the Hawaiian Eye Retina meeting for the past 10 years. It's been under such a great leadership in the past couple of years, and it's really grown in nature. And it provides a different level of education. That's a very comprehensive education for retina specialists who may not go to every meeting there is. They go to one meeting and they want all of it in 1 week and they want to understand it. And obviously it's in a beautiful location, which helps out too. And but it's a great meeting because you get to sit with people next to each other, elbow to elbow, and they have wonderful sessions where you can really just get intimate and talk about something that you might not feel comfortable talking about at a big meeting. And then OSN New York, or Ocular Surgery News New York, is our newest foray. And this is a retina program we're starting this year. Unfortunately, it will be virtual because of the nature of the program. It's coming up in October. We're excited to have it because I think, again, it provides really great comprehensive education, but in a different fashion, in a fashion that melds together a lot of academic institutions from the New York and tri-state area, which again has been some of the best and brightest names on retina are in that area, and we've asked them to come and talk to us about their specific interests and what they're doing, and hopefully boil it down so that people leave on Monday with very, very practical knowledge, something they can use in clinic on Monday. And that's been my kind of driving force. And I love educating. I love educating my colleagues and my fellows and my residents and my medical students and everyone else. It's just something I feel like is my duty as an academic retina physician.
That's very nice. Yeah, I think that's this really shows you've definitely, it seems like you found fulfillment and you find purpose in what you do. And I think these initiatives won't be born without that sort of passion. So it's really inspiring for all of us to see the things that can be done throughout careers and the things that you can continue to build. One thing I want to touch on there was when you mentioned your international partnerships and local partnerships. I'm kind of wondering what is your kind of advice about the keys to collaborative success? So how do you really partner with people to make these kind of things come together to be sustainable? Do you have any thoughts on that?
Yeah, I think there are a couple really good techniques to follow, or I should say themes to follow. The first is that you should be honest with yourself and be honest with them. I think it's very important to tell everyone what the motives are, what the interests are, what you're doing. Um, be deferential. Feel like they can take the lead on something. Other people can help you. Work as a group and team. I'm going to do the finance stuff. You do the agenda. Somebody else does the promotion. Don't feel like you have to do all parts of it. And lastly, be collaborative and be open to ideas. Be able to listen. Some of the things that you might hear the first time around don't sound very good, and they might be half baked, but they can be ideas that are just really going to be impactful if they're done and executed well. I give you an example of that this year. I think the current president of the Retina World Congress is Tariq Hassan, and he's done a wonderful job transitioning this program from a program that just happened once every 2 years in person to a virtual format and happening monthly, and really doing a great job of capturing people from very, very different countries to all come together and give a webinar. And 1,500 to 2,000 people tune in for this thing. It's great. And it's hugely impactful. And at the time, I think, when you think about this, you're like, well, do I really want to do another webinar? Because, are the people then going to come to the meeting? I think actually it's done the opposite. It's created more interest in the meeting than ever before. And I think people are really, really have seen the brand of Retina World Congress grow. And it will continue to grow because I think he's done a great job of really encouraging very large, wide varieties of participants to come and participate in that program each and every month when they do those.
Oh, that sounds awesome. It sounds like the good, effective leadership kind of makes that initiative grow to what it's become. And I read something on Twitter the other day that said that a good leader knows when to be a good follower. So that kind of touches back on, I guess, what some of the themes that you're touching on. And that's quite a significant success you've had, and wishing to see how it grows. And I'm sure it will continue to do so. Dr. Singh, I want to talk about education, and as an academic retina specialist. We're obviously in a place right now where COVID-19 has, impacted, medical training from every level. And, things are going to be different going forward. And I think that's, for some people, that's scary, but in a lot of ways, it's, there's room for innovation and change. And I think that's, there's a lot of revolutionary changes that are happening, I'm sure, even at your institution that you've talked about. So, what are your thoughts on where we're going from here? What are things that make you excited and think positive things to look at?
Yeah. Well, I think we're going to learn how to work remotely and learn remotely. I think this is a great opportunity for us to figure out how to do this. When I talk to my friends in finance or in consulting or in other walks of life, they tell me, "You guys get on a plane every week and travel to different locations. I mean, what are you guys doing over there?" And the honest truth of it is we did it a lot. We would travel a lot, and it's fun, it's interesting, exciting, but I think at some level we have to find the way of connecting virtually, and we just need to find the right tools to do so. So you watch things and, like, these Zoom calls or whatever, they're okay. They get to a point where they're interesting, but there's future technologies that are going to, I think, iterate upon this. I've seen some examples of meeting that actually occurred in Brazil last week, where they had a cool room. They put the moderator in front of a green screen, which you can buy cheaply and put in your home, actually.
Oh,
And then at the wall was, 4 panelists, and it was this really cool picture in picture, looked very interactive, like a game show almost, or like a television show that they were running. And you can imagine that that could be the future of some of these meetings we go to and what we do. We're all, phone based now. Maybe there needs to be more app based and gaming technologies that go involved in this, and maybe that we be able to learn. But there's a lot of different opportunities out there, and I think what we're going to have to do is explore all of them, given the circumstances that we're in right now. Obviously for 3 months, our practices took a hit as well.
sure.
So from an economic perspective, we really need to be home, seeing patients, taking care of our surgeries. And the same token, we have to keep learning. I don't want anyone to feel like, and this is something I've had to kind of message to here, is that yes, we're not traveling, yes, we're not going anywhere, but we need to keep learning, because that's ultimately what keeps us interested in what we're doing. Because if you're just going to see patients and do surgery, for me at least, it's not an interest level as much as it is innovating my surgical technologies or my techniques, or improving my diagnostic capabilities, or doing something different, because that's how we grow. And so for me at least, I think if you don't couple the added benefit of that with patient care, we really are going to be in a tough place. But I think they're doing that now, and I think technologies like this are really helping that.
Yeah, it makes you make a really good point there, Dr. Singh. I think you've really embodied lifelong learning in your career, and you continue to do so. And I think I leave this phone call with you or Zoom call with you, thinking about those things, and hopefully incorporating them in my own career. And it's a pleasure to be with you. So thanks for joining me. And do you want to let anybody know where they can find your website or your Instagram handle, and where they can find you on the virtual world?
Yeah, my Instagram and Facebook and Twitter handle are all Dr. Rishi Singh, or at Dr. Rishi Singh. And the website is www.drrishisingh.com. And again, you'll see different posts, different videos that are up there, surgical stuff, things that went well, things that didn't go well. So it's a very honest approach to what we're doing in practice, and I hope people enjoy it.
All right. Well, as the host of Honestly Bilal, I want to thank you for joining me. I hope that we can meet in person someday, and have a good rest of the day.
Sounds great, Bilal. Good luck, and really, you should be congratulated for what you're doing here. This is wonderful stuff you're putting out each and every time.
Appreciate it. Thank you so much.